Welcome to Body and Soul. What if I told you there was a surgery which could cure your diabetes? For the right patient, this could be absolutely life-saving. Dr. Lam, doesn't that sound pretty impressive?
All diabetic patients will want that.
It is known as a metabolic surgery. Now, if this sounds familiar, we've talked about metabolic syndrome before in relation to diabetes. So is metabolic surgery related to metabolic syndrome? Can you break it down for us, Dr. Lam?
Absolutely. All right, what is metabolic syndrome? It is a cluster of conditions that tend to occur in the same patient. And these conditions are a high blood sugar, high blood pressure, high fats in the blood, and a large waist circumference. How big is large? Well, more than 80 centimeters in a woman or more than 90 centimeters in a man. Now, what would be the risk factors then? Well, if you get older, if you're overweight, and if you have a sedentary lifestyle. But why care in the first place? Well, that's because in a metabolic syndrome, you are metabolically unhealthy with insulin resistance, tendency to diabetes, and a high risk to heart disease and stroke.
My goodness, I can see why it's so dangerous. And what if a surgery could pull you out of that danger zone? DJ Abdul Kathir from Oli 968 wanted to find out if this was an option for him. So we're going to do things a little bit differently on today's episode. A big surgery like this requires consultations with many doctors, making sure they've got all the right information and a series of tests as well. So we're following along with Kathir as he journeys to see these doctors and find out if he could change his life. Let's see what his journey is like. Hi.
Hi, Daniel.
I broke out to meet you.
How are you? Come, take a seat, take a seat.
Thanks for seeing us. Kathir really wants to know whether this is the right surgery for him.
Doctor, my mom has diabetes, then my grandmother has diabetes. So I've always this concern that, I might have diabetes also. And along these years, I've tried many ways to lose weight, like controlling my diet, exercising. But then I have been seeing myself gaining weight. Because I don't eat much, So, but my working lifestyle, the way I sleep, the way I eat, so there's always this concern that how come my weight is gaining? Is my metabolism low? So there's this very high concern of how am I gonna change my lifestyle and see whether I have diabetes, or what can I do about it, Yeah, make some changes.
I think these are very valid questions. Let's start by saying that unfortunately, if you have a family history of diabetes, and because you're related, the odds of you developing diabetes is high, even regardless of whatever kind of lifestyle that you have. So, and unfortunately, there's not very much you can do about your genetics.
Yeah.
However, it's very important to realize that there are many other things you can do, and the challenges that you face are not unusual. Many people are trying to lose weight. I think most of us are trying to lose weight, but it's not always easy. And it's not just about diet and lifestyle per se. If it was, I think everybody would be losing weight. I think what we really need to do in people who are struggling is to really get an assessment, what we call a metabolic assessment. And this is really to measure how well you use energy. Are you using energy effectively? And if you don't, what is the problem? And can we potentially fix it? And based on your history, given the fact that you have a family history of type 2 diabetes and all of us can stand to lose a little bit of weight, I would classify your potential risk as quite high. So we need to run some tests to make sure that things are okay. Then we'll discuss that and see. But broadly, the options are there for you. You can try it yourself. Many people say, I don't want surgery or medicine. So they try and exercise and they diet and they're successful. Obviously, I appreciate your challenges. You may want to try harder if you want to. The other part is that I want medical intervention. In other words, we can help you with dietitian advice. We can help you by measuring your metabolic rate and prescribing a particular lifestyle for you. We have medications to help you in that way. And finally, there's an option of surgery, a metabolic surgery, which can potentially help weight loss and may be suitable in people with high-risk metabolic diseases like high cholesterol, high blood pressure, and diabetes.
So these tests that you've recommended, are they the same kinds of tests you would recommend for someone who would want to do the metabolic surgery?
Generally, I would. I think if you're thinking of metabolic surgery, as you can say, it is a one-way street. You can't say, doctor, I don't want the surgery anymore 3 months after you've had it. So it is a commitment. It is a commitment, but there are, as you correctly pointed out, significant health benefits. So I believe that before you go down for or even consider metabolic surgery, there are a few questions to ask. The first one, from the doctor's perspective, are there any diseases that are causing me to gain weight? Because if you do that, if you do metabolic surgery and you have a disease, then you're wasting your time. The second is that, are there any medical indications? In other words, I have uncontrolled diabetes, blood pressure is off, and other health problems that make you significantly benefit. Because these two things need to be considered first. Then the final part, that's the doctor's perspective. Then it comes down to the patient's perspective. How much do I want this? You know, this is irreversible. And I think it's very clear, Daniel, as I tell all my patients, this is not a Hollywood story. It's not one picture you go in, you see you going for surgery, and 2 months later you are 30 kilograms lighter and dancing in the fields. It's not as simple as that. You know, there's a commitment. There's a commitment. There is a struggle. There are challenges to prepare before surgery, and there are challenges after surgery. But the health benefits are very, very clear. You will benefit. And the most important thing, Carter, is to see if you're going to consider it, is whether you are the correct person for the procedure.
That's it. We want to find out if he's the right candidate, and of course, if there are other options as well. Carter, what do you think? Are you up for doing some tests with Dr. Ng right now?
Yeah, definitely.
Okay, Dr. Ng, can we do that right away?
Come on, let's go.
So, Dr. Ng, what's this test trying to analyze here?
So what we're doing on Carter at the moment is called a body composition analysis. And what it does really is measure the amount of fat and muscle Carter has. This is an initial test to really see the metabolic status of Carter, and basically gives a baseline on whether we can improve it or not in the future.
Okay, this looks a bit more complicated than I expected. Dr. Ng, what is this trying to analyze?
Well, Daniel, as what you can see now, Carter's breathing into this machine, and we're doing a procedure on what we call indirect calorimetry. And what it does is that as Carter breathes in, he takes in oxygen and he breathes out carbon dioxide. So he's metabolizing energy, using that to metabolize energy. And what indirect calorimetry can do is it can measure the amount of energy Carter's burning over a period of time. And more importantly, as you know, there are two kinds of energy, fat and sugar. How much fat is being burned and how much sugar is being burned. We use that information then to potentially help Carter to burn better energy and improve his metabolism.
Okay, we're going to let Carter continue with his tests and see what kind of health status he's in. We'll be right back on Body and Soul after the commercial break.
So Daniel, it's good that I've gone through this test, but the truth is, I'm just worried about the surgery.
I understand a surgery like this, any surgery, can be quite scary, right?
Yeah.
You know what I think would be helpful? If we spoke to a surgeon who actually performs this procedure, and we can clear out all the doubts that you have, okay?
Okay.
Let's do that right here.
Dr. Rao, I'm very nervous about the surgery. I just want to know that I meet the criteria. Who is this for?
So basically, if your BMI is more than 32.5 with any single comorbidity such as diabetes, high blood pressure, high cholesterol, etc., or if your BMI is more than 37.5 even without any comorbidity, then you're suitable for this procedure. And it is recommended by the Ministry of Health guidelines for treatment of obesity as well as diabetes and metabolic syndrome.
Sounds like these are very strict guidelines that they really have to be adhered to. This is not an elective procedure by any means, right?
No. It requires a multidisciplinary team assessment for you to make sure that you fit into the criteria. We have to take you through a certain processes, and only then we can recommend this surgery.
But basically, it's still surgery. There's cutting, it's invasive. It's a bit daunting to the average person as well. Maybe you can explain to Carter what exactly happens with metabolic surgery.
Yes. So metabolic surgery, firstly, is not daunting, so you should not worry about it. It's a keyhole surgery, so we do it with tiny incisions. And what we're going to do is basically, we create a small stomach pouch, and this will help you to restrict the amount of food that you eat. And then we're going to bypass your initial part of the other part of remnant stomach and some part of your intestine, so that the food does not mix with a lot of your bile and your insulin. So what happens here is that there's a twofold benefit. One is that you have weight loss because you're eating less. And second, the excess amount of enzymes that will digest your fat, that doesn't happen, and it happens much later. So if you have more fat and oil in your food, automatically you will feel uneasy and you may purge it out, and you'll automatically make healthy choices after that to eat more healthy food. In that way, your diabetes also can come under control.
But Dr. Rao, will this surgery fundamentally cure someone's diabetes?
We don't use the word cure, but essentially, yes, we use the word remission. So we would get like almost 80 to 90% diabetes remission after this.
Can we see how the surgery looks like?
So here's what the surgery is going to look like. We're going to be making tiny, small incisions or keyhole incisions to get into your abdomen. Then what we're going to do is we're going to make your stomach into a really small pouch. So this pouch is about 80 mils and will just contain 80 mils of food and water. Then what we're going to do is we're going to detach your intestine and join it at this pouch so that it bypasses your remnant stomach. In this way, your diabetes and your obesity can come under control. You'll have good weight loss as well as your diabetes can come under remission.
It looks very invasive what you're doing there. Can somebody recover well and easily?
Yes, usually the length of stay is just about a day or two, and it's done in a keyhole manner, so the pain is minimal. Usually after your surgery, you'll have 2 weeks of liquid diet, then 2 weeks of puree diet, then 2 weeks of semi-solid diet, and then you have your normal diet. But you'll be eating in really small amount, but more frequently. This is what we actually want because we want to increase your metabolic rate. And that's the best way, by eating in small amount more frequently.
Doctor, if I'm suitable to do this surgery, what's in store for me?
So basically what happens is that if you meet the eligibility criteria, we will have to do some blood tests to screen you. We would have to do an endoscopy to make sure your stomach is okay and there's no other pathology. You will need to see a multidisciplinary team, which will consist of an endocrinologist, a dietitian, maybe even a psychologist, to make you aware and to, go through with you through this entire journey. And this is very important to have a multidisciplinary team. And this will make your recovery much better and you'll have better outcomes. We've done studies to show that those who have been treated by a multidisciplinary team with good follow-up have got great outcomes. So then we can plan out for your surgery. While we're planning for your surgery, we want you to go on what is called as a very low-calorie diet and prepare your liver and stomach for this surgery. This involves taking a very low-calorie, specially designed meals for at least 2 to 3 weeks. This will shrink your liver and help us in the surgery, make the surgery with better outcomes, and you have a better outcome after that with better weight loss and diabetes control.
Doctor, thank you very much for all the information.
Thank you so much. You're welcome.
You've heard about a liquid diet. It's a fad diet some people take to lose weight. Is that safe? Is it effective? Let's find out. I'm here with Riddhi Naidu, who's a dietitian. Let's get the answers on a liquid diet, Riddhi. What exactly is a liquid diet and who's it for?
Liquid diet, basically, it's looking into calorie around 1,000 to 1,002 per day. So for a normal person, it would be challenging to achieve it. But for patients who are undergoing bariatric surgery, this is the option. So 2 weeks before the surgery and 2 weeks post-surgery, they are advised to follow this liquid diet. So these are the items that we usually use for the liquid diet, like a shake, which is a complete nutrition supplement, and it's medical grade. And we have various different kind of shakes. So it depends on what existing conditions they actually have, like diabetes or kidney problem. Then we would use a suitable one for that.
So wait, you just drink shakes for 3 meals a day?
So on top of it, they are allowed to have different, some kind of foods, but not regular foods. It could be things like really soft or a similar liquid texture.
But as a patient, why am I doing this? What's the benefit?
Liquid diet actually helps to reduce your fat intake and also calorie control, right? So basically we are trying to aim for a weight loss even before your surgery. So maybe we're looking at 3 to 4 kilo before the surgery. So apart from that, like I said, if you reduce your fat intake, we're also looking into reducing your visceral fat, which is the fat around your organs. On top of it, patients also can see improvement in their cholesterol and glucose profile.
Riddhi, let's say I'm not a patient who's going for a surgery, but I still want to try a liquid diet to lose some weight. Is that healthy? Is that okay?
Basically, if you want to go on a liquid diet, similar to this, you have different factors that will affect it. For example, your age, if you have existing medical condition, are you on insulin therapy, or even the work that you do, if it's very energy consuming, then it would not be suitable. So it's always advisable that you see a doctor or a dietitian to help you plan like a more well-balanced liquid diet. On top of it, if you want to do it in a simple way, you can always start with a shake meal replacement, but medical grade one, and then just replace one meal a day, and also reduce your fat intake. So for example, like deep fried food, dairy products has to be low fat, and also reduce your intake of empty calories, like all the sugary drinks and stuff. So that will reduce your calorie intake drastically.
Could I do this long term or for just a short period of time?
Yeah, so actually it's not for long term using all this thing. The main thing is that you might get nutrient deficient. That's why topping up with nutrient supplements is important. So you can do it for like 2 weeks or 3 weeks, and also review with a doctor and a dietitian.
That was really useful. Now we understand what a liquid diet is all about, who it is suited for, and what you should consider if you too want to start making some healthier choices in your diet and lifestyle.
For many chronic medical conditions like diabetes and high blood pressure, continuous monitoring is very important to optimally manage the condition and avoid complications. That's well and good when patients can go to the hospital and see their doctor. But what happens when they cannot? Can technology help? Well, telehealth is the delivery of healthcare services at a distance through the use of technology. And that could be anything from conducting medical visits over the computer to monitoring patients' vital signs remotely. Now that's really cool, right? Because the patient, through apps and devices, can transmit their vital signs to the doctor, and the doctor can act on that to titrate the medications. The advantages are obvious: convenience, ability to provide care to people with poor mobility, or even to those in rural areas. But remember, not every condition can be managed remotely, and you may still need to go to the office or the hospital for things like imaging tests or blood work, as well as for diagnoses that require a more hands-on approach. And that was your MedTech Minute.
What a journey we've been on with Kartha and all these consultations with our doctors. We're back in the studio. It's time to get the results and see where Kartha stands on metabolic surgery. Dr. Ng, let's start with you perhaps. How did the results go?
Well, Kartha, you had a chance to do quite a number of tests with us to really get your metabolic assessment and all done. And unfortunately, the results aren't quite as good as we would like. For instance, your blood sugars are a little bit elevated, your cholesterol levels are a little bit high, and your metabolic rate is not quite as good as we want. And one of the main reasons, as you can imagine, is that all of us can lose a few pounds, and I think the weight certainly is contributing, at least in part, to the problems that you're having.
Yeah, Dr. Ben. So that means, let's say now, if I don't choose to go to the metabolic surgery first, right? Now the question is, can I use diet as an option to change my lifestyle so that I can get the BMI down before really thinking about going into a metabolic surgery?
I think the important thing to appreciate here, Kartha, is that you have a choice. At the end of the day, there are many potential options for therapy. Metabolic surgery is a very effective, powerful treatment, but there are options you can try for. You can speak to a dietitian, you can consider medication, you can try increasing your physical activity. And I think the important thing is that you have to be determined and you have to be convinced which option is the best for you.
Dr. Rao, do we want to wait and give time for lifestyle changes rather than going to a surgical option straight away for Kartha?
Well, I'm going to give the inconvenient truth. And the data suggests that if your BMI is more than 35 with any comorbidity, then the chance of just losing that weight by diet and exercise is less than 5%. And metabolic surgery has shown to have the best results for this, and therefore it's actually now recommended for somebody with a BMI of more than 35 with any single comorbidity. But I completely agree that we do need to have some time to have diet, exercise before considering surgery.
Definitely, I will not be waiting till the last minute to make some changes in my life. So the first option will be to see whether I can really go into the diet route. If that doesn't work, then definitely I have to go to the metabolic surgery route so that things can get better for me in terms of my BMI. But how things will be after the surgery?
Well, with surgery, there'll be very good weight loss. And with that, the minute you have about 10 to 15% excess body weight loss, you'll start to see the changes already. And studies have also shown that if you have an early intervention, you have better results and a better quality of life.
But can the recovery process actually be very challenging?
There's a short recovery because nowadays it's done with a keyhole method. So it's short and the recovery is quite fast. And within 2 weeks, you can get back to work and normal life.
So, Kantha, what's the verdict, you think?
Well, I have options now. Previously, I don't know what I'm going to do. But right now, I know what I can do. So basically, there's a lot to think about. Yeah. Go back home and see whether I want to take the diet route or straight jump into going to metabolic surgery.
That's exactly why I did the show this way. I wanted everybody to see the process that has to happen, the consultations. This is not a light decision that needs to be made. You need the input of the experts as well. So I'm going to leave you with the thought and, of course, what could be a life-changing decision as well. Kantha, thank you for letting us follow your journey.
Yeah, thank
Doctors,
you,
thanks for your input. Appreciate it.
Thank you. Pleasure.
Thank you.
All the best to you, Kantha.
Yeah, thank you, Dr. Rao.
I'm so glad we went on this journey with Kantha, seeing the doctors, getting the consultations, doing the tests, seeing what goes into a big decision like potentially getting metabolic surgery. It could save someone's life for the right patient, but you need to do your consults and take your time with that decision, of course. Professor Lam, what do our viewers need to remember about today's topic?
Well, we saw metabolic surgery. What a great advancement in medicine. It could even reverse diabetes, right? However, we also saw it's not for everyone. Do you know what is for everyone? A healthy lifestyle. Physical activity, maintaining an optimal weight, and eating a healthy diet can prevent and even treat metabolic syndrome.
And you know what else is for everyone? Watching episodes of Body and Soul right now on Me Watch. Head on over and binge away. It's fine, no calories involved. Thank you all for joining us on this episode. More great topics lined up for the rest of Season 9 on Body and Soul on Channel 5. Stay healthy, everyone. Bye.